A small reminder about the dinner. The conference will continue with the dinner at the end. I would like to say that you are all very welcome here. And now, I would like to invite Dr. Mishtiman Hashim on the stage to be the moderator of our scientific meeting.
تحية طيبة باسمي وباسم مستشفى ويستاي للجنود أرحب بكم وأشكركم لقبول دعوتنا المتواضعة، وأخص بالشكر الأخ العزيز حمزة الماجدي رئيس جمعية الأطباء العيون العراقية والوفد المرافق له، وكل أمل أن تتكرر زياراته لنا لأننا معا نكون أجمل. زملائي وزميلاتي، أطلب من الأخ الدكتور أسرام ويراس لكي يتحدث لنا عن موضوع سمايل. دكتور.
Good evening, dear doctors and dear colleagues. First of all, I would like to thank you for accepting our invitation and attending this conference. As you know, today the main substance of our conference is the orbital surgery, but I would like to say we are glad to announce the SMILE technology now at the Westeye Hospital, and I would like to give you some information about SMILE surgery. Yes. What is the relaxed SMILE? SMILE is small incision intralenticular extraction. The Zeiss SMILE uses femtosecond laser to correct myopia and astigmatism. We have one lenticle and small incision for remove the lenticle, the intact cornea. Next. The Visomax femtosecond laser more than just SMILE. With this machine, we can use the basic flaps, we can use the intrastromal corneal rings, and we can use the keratoplasty. Next. The relaxed SMILE indication range for myopia and astigmatism for SPAR from -1 and to -10 for syndrome, from -0.20, 0.75 to -3 dioptry. Next. And what is the advantage of the SMILE laser? The SMILE technology of the flapless and no flap surgery complication, and SMILE support fast healing and fast recovery of corneal sensitivity and tear film, so lower incidence of dry eye syndrome. It's very important for basic, for refractive patient, and minimal invasive, approximately 4 mm, and we need just one laser, and all procedure use the femtosecond, no other or noise, and SMILE has the potential to preserve biomechanical stability because we don't cut the anterior stromal cornea and we don't cut the bone layer. Next. Normal nerve plexus, you can see the 360 degree on the cornea. In the LASIK flap, we are interrupting the 10 o'clock hours. In SMILE surgery, we are interrupting 1 or 2 o'clock, and then less impact on the corneal surface and nerves. And it's important for a fast recovery, corneal healthy and corneal sensitivity. Next. Next, please. And now I would like to show you surgery steps. First step, we're washing the corneal surface. Balls washing corneal surface for corneal epithelium. And put the cone, this is the corneal contact glass, as known cone. And the second step, the docking and suction Now first touch the cornea and comb. Patient look the green light. Now section on. Yes, first lamellar cutting. This is the posterior surface of lenticle. And the second cut, this is the side cut. And the anterior surface of lenticle cut from center to peripheral. And finally, there is a small 4 mm side cut. How do we separate the lenticle? First, I open over the lenticle. Yes, first, I enter the corridor and open the over. And then I find in the lower side and open under the lenticle. Now I find the lower side, yeah. And then I first upper interface, I separated the upper interface, and then the lower interface is separated. First, upper interface, end of the lenticle. And now the lower interface I separated. And finally, I remove the lenticle with forceps. And then clean the cornea. Thank you for your attention.
ضيوفنا الافاضل، يسرني ويسعدني ان اقدم لكم الاخ العزيز دكتور يكتا، وهو اخصائي عمليات محجر العين وتجميل العيون، واترك له الحديث لكي يحدثنا عن تجاربه وعن العمليات التي يجريها. فلنمتعد دكتور.
Thank you, Dr. Mishman. Dear colleagues, welcome. هم بخير هاتين، سير سلام، سير شبان، مرحبا، أهلا وسهلا. Before starting the presentation, I would like to introduce myself in a few sentences. I am Dr. Yekta Şendil from Turkey. I graduated from Istanbul University Medicine Faculty in 2003. Between 2005 and 2010 years, I received specialist training at Şişli Hamdi Diyarbakır Training and Research Hospital. Again, I worked in the same center for 10 years and became an associate professor in 2020. Recently, I joined Westeye Hospital family. Tonight, I don't want to bore you too much. So, I want to continue my presentation in the form of surgical video. If you have any questions throughout presentation, I will be happy to answer all of them. I hope we all have a good time together tonight. My first video about orbital schwannoma. You see, we marked skin crease line and performed incision. And now we are performing blunt section. We are working to roll superior orbital ring. Make hemostasis. This is superior orbital ring periostoma. Now we perform incision on periostoma. We want to arrive to mass. Yes, you see the mass on superior orbital. Mostly I draw blunt section in the orbital region. You see, this is supraorbital nerve and vessel package. This nerve. We cut it. You see very big mass. Yes. The second video about orbital abscess. You see we marked incision line and performed incision just below the eyebrow. You want to drive superior orbital ring again. You perform an incision on the periosteum of the superior orbital ring. Now you see the abscess is draining. And we took a sample for culture. We washed the area with solid solution and we applied povidone iode for 2 times, 2 minutes, and again washed with solid solution. Situation of periosteum and skin. This video about subperostal hemolytic cyst. Again, we marked the incision line and performed incision and working to arrive the superior orbital ring again. Performed incision on the superior orbital ring periosteum, and we want to arise periosteum from the superior orbital ring. You see a brownish blood came out from the periosteal area. The hemolytic cyst normally became after brain trauma. This cyst formed by a blood leaking into the orbit after intracranial bleeding. Again, we washed and applied povidone iode. washing of the area, and doing force-addition test, situation of the periosteum and skin. Next video about intraconal hemangioma. We performed lateral contutomy and conturesis. Then performed conjunctival incision horizontally just below the lower eye tarsus. I want to feel the inferior orbital rim with my finger. After lifting the upper conjunctival 1 to 4, we continue to plant section. We perform incision on the inferior orbital rim periosteum. Inferior orbital rim. Entered orbita. We work to right intraconal area between inferior and medial rectus muscle. As you see, yes. At this stage, we used the Cryo device for extraction of the mass. As you see the mass size, about 2 centimeters. This video about lateral intubation. First, we widen the punctum with punctum dilatator. Then we performed probing with lacrimal probe for both lacrimal side. And check it, the type of the probe into nasal cavity. For the inferior side, check it probe. Then we insert the lacrimal tube into punctum and advance it through the upper canaliculi, lacrimal sac, nasolacrimal canal till the inferior malleus. After checking, we took out to wider older probe. We took out the tube, wider older probe, and then performed the for the other side. with certitude and confidence. Then we tie the ends of the tooth.